All right, it's Saturday. Get your pens and papers out. Throw your straws in the trash because we're talking about lip lines. Who the hell am I? I am Dr. Shereene Idriss, a board-certified dermatologist. My focus is on cosmetics, and you have landed in skincare, cosmetic, beauty industry heaven, where we do this every Saturday at 10 a.m. So if you haven't subscribed, subscribe, like, and follow along. Let me know what you want to learn about next week. Today, we are tackling lip lines because this is the #1 cosmetic concern that my patients have when they come into the practice. And it is not just the bane of your existence, but mine as well. Because lip lines are a pain in the ass. They are inevitable, and we are going to get into it today. They're also known as smoker lines, vertical lines, lipstick lines. No one calls them straw lines, but they should be called straw lines, barcode lines, you name it. That is what they are, and they are going to form. It is absolutely normal for you to have them, see them, or even develop them. But the reality is we can minimize how they form and how bad they get, and maybe even try to reverse some of the damage once it's there. In this video, we're going to talk about why we get the lip lines and then things you can do to yourselves to help yourselves minimize how bad they get, followed by at-home treatments and in-office procedures. But lip lines are one of those things that are due to a multitude of different things. And I can guarantee you that you will get them as you get wiser in life. Why? Because you are using your mouth every single day, from now until your last breath. And even at your last breath, you're gonna be using your mouth. You know what I mean? So you're going to be developing those lip lines as you get wiser and as we progress over time. And the goal is not to try to fight them completely because you will look, quite frankly, like a sitting duck, but how best to help yourself. Why do we develop lip lines? Every single human, you are made of flesh and bone and blood and skin, you are human, starts to lose collagen and elastin as they get wiser in life. And as we lose collagen and elastin, our lips tend to get thinner, not just the mucosal part, but the cutaneous part. And as they tend to get thinner and they start to shrivel up, we start to develop lines vertically along the border of our lip. #2, genetics. Look at your family. They are the blueprint of what is to happen to you because you are going to age like your family. They are your genetic blueprint. So if they have crevices on their faces, you probably want to start working on this at a younger age in the sense of lifestyle changes, helping yourself through the process, etc., being smarter about your skincare than allowing these lines to form because they're harder to treat once they're there than to help to minimize them from forming. #3, dehydration behaviorally. If you're not drinking enough water, your lip lines are going to show more. #4, hormonal changes because menopause is upon us. And with menopause comes hormonal changes that changes the quality of our skin and lip lines will form. And last, repetitive movement. Smoking, straw drinking, and other activities can all lead to lip lines, but smoking and straw drinking probably are the biggest ones. Smoking and straws are equal. Yeah, they are. Because you're putting them literally in the middle of your mouth, pursing your lips, trying to get that liquid or that smoke into your lungs or your stomach. And therefore, those lines are going to form. Smoking, though, has a double whammy of making your lip lines worse because it's minimizing your blood supply to your skin, making your skin look yellower in the process, more sallow, decreasing how healthy it is, and making those lip lines form faster. So just something for food for thought. If you're going to quit smoking and you just don't have it in you, but you're vain, do it for vanity's sake and not necessarily your health. So what can we do then to slow down this from all happening? #1, lifestyle changes. We can be more conscious of how we are consuming fluids. Are we hydrated adequately, etc.? #2, do we really need to smoke? Can we quit smoking? Because it's going to be better for us overall. Yes, for vanity's sake, but also for our health. #3, straws. Do we have to quit straws completely? I mentioned in the beginning of this video, throw your straws in the trash, but I was being a little facetious because stupid inventions have been made of late, like this one, where there is some fancy, weird looking straw that people are drinking out of in order to minimize their lip lines. But the reality is you could just take your straw and pop it to the corner of your mouth and get the fluid into your stomach that way. So you can actually change how you use your straw to minimize your lip lines. And last, this is one that is very much often overlooked, especially by injectors and cosmetic dermatologists alike, your teeth. As we get older, our teeth start to shift back, they become crowded, we become narrower, etc. And as our teeth start to shift back, this area gets longer. And as this area gets longer and we lose collagen and elastin, this starts to sink in. And therefore we end up starting to look like this. That is a scary thought. So when you start looking at your teeth as you get older, sometimes there is value in fixing and addressing your teeth to push them forward so that your lip can sit nicely on top of your teeth and not roll in because it has no structural support underneath it. That is some food for thought right there. Now, when we talk about skincare that we put on our face, we can put on our lips, starting with sunscreen. Now, not everybody wants to use a tinted sunscreen all over their face and their lips because it will sit on their lips and they will eventually develop a white line across the border of their lip. But if you are using a transparent chemical sunscreen that is very elegant and easy to apply, you can take a thin layer and put it over your lips. If you're not into that, go for SPF lip balms. At my practice, I give these out like candy. It's only SPF 15, but people reapply this all the time. And so it's easier to reapply and use throughout the day. Otherwise, Supergoop, Sunbum, they all have lip balms with SPF that you could look into. It has a little funky aftertaste. If we can crack that, we will win. Now, you can also plump up your lips through skincare. Can you use hyaluronic acid to draw moisture in and to lock it in? Yeah, you can put HA followed by a thick occlusive layer on top. HA for me has been inflammatory and I found that it irritates my lips a little bit and I feel like they get more chapped in the process. So I actually sometimes do this with just glycerin. But a favorite hack of mine is lip basting. When we combine a chemical exfoliator, not a physical scrub, to exfoliate our lips evenly while promoting long-term collagen production. So things with glucanolactone or glycolic acid, perfect. Followed by a thick, rich, occlusive ointment or cream on top of it to lock that hydration in while delivering moisture. That is lip basting for you. I will link below my video. It is a hack that I've coined. I'm obsessed with it. It is part of the basting hacks that I do with my face and my lips, etc. etc. No, I'm kidding. Maybe not, maybe. But lip basting is a very fun hack and it does save my lips every single winter. And I do think my lips look better today than like even 4 years ago because I've been doing it consistently and I do think they are slightly smoother and softer and I do not inject my lips with fillers. I have tried fillers twice. The first time I gave myself a massive bruise because I inject myself and so I quit. And the second time I tried to see what it felt like. So I sucked it up and I put probably 0.1 cc's of filler because I didn't want to have fillers so much in my lips. I was not into it because I think I have big lips to begin with. So we took a little left turn, but let's get back onto things. So lip basting is a great hack. And I do think my lips look better today because of that and not the fillers because I hardly put anything in there. And then you have retinols. Now, in previous videos, I have described this area as the kiss of death when it comes to retinols because most people cannot tolerate a retinol over here. But if you're not sensitive and if you are able to tolerate retinols around your mouth, utilizing a retinol around your mouth can really help your mouth and this area in the long run. And if you want to test it out, what I would strongly suggest you do is use like a hydrating serum and a moisturizer as a barrier or a buffer. Put that first and then use the very, very light over-the-counter retinol, like a retinol 0.3%, over this area and even on your lips. And do that like twice a week to start. See if you can work your way up. And this will help promote collagen production and cellular proliferation over time in this area, making it better for you. Now heading into devices at home, because devices are sexy and people want to sell you a device. And people want to buy devices even though they don't necessarily use them. If you have melasma, just be careful, especially with the LED lights, whether they are red LED or near infrared LEDs, because some of them get hot and they flare up the melasma. I actually don't really use these devices myself because I've noticed my brown spots look worse. But if you don't have melasma, you could try these treatments and see if they help. Again, it's very hard to compare devices, so I am not promoting these devices. I'm giving you guys options for you guys to look into. But Current Body, which is a very reputable LED brand, has an LED lip perfector at $189. Dr. Dennis Gross also has one for $148. LEDs specifically made for the lips, great, sure, you could use them, but the reality is the juice worth the squeeze only if you squeeze every day. And so you're gonna have to use these very consistently every single day, very long term in order to see any sort of difference. The Lima laser is that really long black device that costs like $2,000. It's actually next to my bed. I have one. I don't know how good it is. You need to literally sit anywhere from 2 to 3 minutes per section in order to see changes, but you have to do that every day long term. I do not have the patience nor the bandwidth nor the time to do that, but if you do and you have this device, slop it on top of your lips and just sit there for 5 minutes. Hopefully, if you do that every day, it will help. It is low-level laser therapy. If you have it, do it, and don't underestimate the effects of placebo. Now, new face, Zip, microcurrent. Those are devices that help to stimulate collagen production by delivering microcurrent to your skin. It's going to help support the structure of your mouth by doing it on your upper lip and your lower lip, and even sometimes over your lips, allowing your muscles to gently contract in the process. It can make a difference in the long run by creating that support that your mouth needs. But remember what I said about your teeth. Always start with your teeth to see where your teeth are at before doing all this, because if your teeth are completely receding and you're doing this, it's going to be very hard for you to see a difference. Now, last are frownies or silicone gel tape. This is what I refer to as designer silicone. This is what I refer to as your regular silicone. In my world, created equal. You can just buy this. It's $8.99 and cut it up into pieces, and you can slap them on your face. Now, silicone is not going to be a miracle cure. It's not going to block you from ever forming any fine lines or wrinkle, but what it does is that it traps moisture between your skin and the actual patch, allowing your skin to plump up more efficiently. So if you did this every night, forever, in theory, the lines should be less deep over time. Now, when you do it at night, you might wake up thinking, wow, I look great, but those lines come back within 5 minutes. That's normal. But if you keep doing it slowly over time, are you gonna get some benefit in the long run? My hypothesis would say possibly yes. And you can literally buy these for $8.99 and reuse them. Just make sure to really clean them so that we don't reintroduce bacteria or drool, and we don't just get perioral dermatitis or acne around our mouth. Now, this leads me to in-office treatments. When we're thinking of the mouth, you have to think of two things, superficial and deep. Superficially, we have our mucosal anatomy and our cutaneous anatomy, meaning our skin and our mucosa. Deep, we have our volume, which gives us the nice cushion in our lips. And then we have our musculature, which contracts our muscle. So you have to look at a lip through 4 different angles. Where is she losing volume? How long is her lip? How is she moving? Is there a lack of actual tissue tensile strength over there? And that's how you address the mouth. When you are losing just volume, let's say my lips just look like this, and when I smile, I'm like this, and when I talk, I'm like this. This is a case where you're gonna be developing lip lines slightly faster because you don't have that structural support for your lip. And getting a little bit of filler, a little bit being the key word over here, slowly over time to slowly build a foundation for your lips can help minimize how deep those lines get. But not all fillers created equal. There are different weights, there are different densities, and it really depends on your injector's aesthetic point of view, as well as their ethics, and their knowledge of how to inject that's gonna give you a natural outcome or not. So you have to really be careful when it comes to fillers on your lips because you can look like a sitting duck. Then we have, remember what I said about muscle movement, right? If, let's say my lip was like this, but each time I smile or I feel it rolled in because my muscle is so strong. This is where Botox can be helpful to relax the muscle around your mouth so it doesn't roll in. Lip flip Botox, where they put it on the edge of your mouth to relax the muscles, allowing you not to contract as much, minimizing the deep lines that form in the process. So that's another thing that you could easily do around the mouth. Now, there are other things that we have available to us if you do not want fillers, like PRP and PRF, where we take your blood, we spin it, we inject it. It's not going to cause a massive burst of volume, but what it might do is cause an increase in tensile strength, tissue strength that you have around your mouth, making your mouth overall slightly firmer so that it can age better. And then if you don't want to go through any injections, you can have surgery. And through surgery, you can either cut the excess tissue right here, also known as a lip lift, where people cut that. I've seen terrible scars on the bottom of noses. I'll probably tell you that I've seen more worse scars than non-discernible scars. And I think the older you are, like 55, 60 plus, the more you can get away with getting a scar here because it doesn't show as much at that age when you do it then. But when you do it in your 20s or 30s, because of the tensile tissue strength, they tend to look red and ugly on the bottom of your nose. So I would try to hold off on doing it in your 20s and 30s for the most part if you haven't found the right plastic surgeon. And some people even get lip implants where they put a tiny little tube in their upper lip or lower lip to give their lip that strength and that volume. Now, if you don't want to have surgery, you can also do laser treatments or microneedling treatments. Microneedling is going to help stimulate collagen production. If you marry the microneedling to heat, you're going to stimulate your fibroblasts to really push that collagen out. And last, you can burn the surface of your skin with a laser resurfacing treatment like a CO2 laser. I do not recommend this starting at a young age because you will look waxy as you get older. I usually recommend that as a last resort when somebody is much older trying to really turn back time. And if they are getting a facelift or undergoing surgery, I tell them to do it then because they're not going to feel it as bad. And then they're going to have the time to recover because of the surgery's recovery time as well. But if you're somebody who's young trying to chase a fine line, I would not be chasing it with a resurfacing ablative CO2 laser starting in your 20s or 30s. That is crazy, but it's happening because people just want your money. So anyway, I hope you guys enjoyed this Saturday's YouTube video. I hope it helped answer your lip line questions, but let me know if you guys have any questions below. I hope this was helpful in helping you not only treat them while they're there, but ideally prevent them and minimize them. All right, have a beautiful Saturday. I will see you guys